Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director. Today's Thursday, June 17th, giving you the update from Albany Med. All right, he's back. You weren't here Tuesday.
I wasn't here Tuesday.
It was weird.
It was.
But you're back. All right, first graph, Capital Region, 8 counties. Number continues to come down, so we're at 30 in those hospitals being treated for COVID or diagnosed with COVID, I guess we should say.
That's right.
Next graph, we're not going to put it up yet, but admissions and discharges. Interestingly, if you look over the last 7 days, it's binary.
That's right.
But it's a great binary.
That's right.
So here's how many admissions we've had per day over the last 7 days. 1, 1, 0, 0, 1, 1, 0.
And so if you're a computer programmer, can you translate
yes,
that for us?
That must mean something. I'm sure
it does.
Somebody will tell us.
Somebody tell us what that means.
All right, but it's 1 or it's none. So it's fantastic news there.
That is good.
So what does that translate here to the medical center? In the morning, 12 currently in the hospital diagnosed with COVID. Fred, 6 are no longer infected.
That's right.
So of those 6,
half.
1's on the floor. 5 are in the ICU, but only 1 of those are on a ventilator, which is great news. And let's see, of the 12 that are in the hospital, who are over the age of 45, 10 of them, 10 of the 12. So it still tends to be a bit of an older population.
That's right.
Let's talk about vaccine numbers. So Fred, on Tuesday of this week, we talked about how the governor had lifted really the majority of the New York State COVID restrictions.
That's right.
We crossed an important threshold in the state.
More than 70% of the population receiving at least 1 dose of vaccine.
That's what, and that was the threshold. Now, which was great news, and we talked about that. Importantly, in the capital region, we had passed that a while ago.
That's right.
The capital region is at 72.5%, and we're proud of the efforts everywhere in the capital region. Schenectady County still leading the state, 78.8%.
Isn't that
of
tremendous?
18 above having received 1 dose.
That's tremendous.
Earlier in this week, I had the great opportunity to be out in Rensselaer County with County Executive Steve McLaughlin and Carm Bazile from CDTA. Their Vax Bus going out into the community as we transition from larger pod sites to pushing the vaccine to individuals. So still some work to do. I think in the last week, we've still been pretty busy with vaccines.
I think we've done 9,000 doses administered, yes.
So still very busy work out there, and that's great. Fred, The Lancet. We know this to be a very popular and well-respected medical journal. Has an article that you'd like to talk about.
So very interesting article. So yesterday there was a question at Town Hall about needing booster shots and that sort of thing. So it kind of ties to this. So LabCorp, National Laboratory Company, looked at the duration of neutralizing antibodies, how long they remain in your bloodstream after infection. So they actually looked at 39,000 people who tested positive for COVID, and then at some point after that had a serology test looking for antibodies. And at 300 days out, so almost a year, 90% of people still had neutralizing antibodies.
So first of all, you said neutralizing antibody.
So those are antibodies that you develop that will attack the virus and prevent you from getting the infection if you're exposed again.
So that's incredible. So that's about the 3rd or 4th update we've had here since we did this that keeps moving that window out. As far as how long out they detect the antibodies, and that's because we're having more experience with it.
That's right. I mean, if you think about it, the pandemic has only existed for about 15 or 16 months. So, it's going to take a little while to understand the full duration of protection.
So the question came in the context of, will we need a booster? I think the answer is we still have not heard anything officially about that.
That's right.
But this will inform those decisions as we go forward.
This kind of information.
All right, great. Let's pivot. Let's talk about an E2 DAISY Award winner. We talk about this at least once a month. These are awards where members of our nursing staff are recognized by patients or families of patients for extraordinary acts of kindness and grace at the bedside. And today was a very special one that was announced.
It was. Today, Roger Cesare from E2 received the DAISY Award. Now, E2 is our psychiatry, our inpatient psychiatry unit, and I think it's really remarkable to be that caring and attentive to have a patient recognize you from that ward.
It is, and the things they said about him are really pretty remarkable.
Refer to him as an absolute angel looking out for me.
Wonderful.
Yeah, really tremendous.
So E2 can look forward to the cinnamon buns, and we thank Roger
That's
for
right.
everything.
Thank you, Roger. Congratulations.
Yeah, for sure.
Great job.
Great news for our workforce. Many have been asking for this, and Monday we have some, well, starting Monday, we're going to have an opportunity for another entry into the hospital for our workforce.
So we're going to open up the BE entrance.
Yes.
It's going to be swipe access for employees only, 6 a.m. to 6 p.m. So
Right.
that should accommodate the vast majority of people who want to use that entrance coming from other buildings at that end of the campus.
Yeah. I don't know about you. A lot of people have been asking me
Yes,
for a couple
absolutely.
weeks. And we obviously wanted to wait until we could do it safely.
That's right.
And we can. And we know that'll save people a significant amount of walking. So that's great news.
Visitors and vendors and other folks coming into the hospital will still have to either use the west entrance or the B2 entrance.
All right, so 6A to 6P,
6P,
7 days a
employees
week,
only.
but starting Monday.
That's right.
All right, very good. And thank you to security,
Yes.
who helped us make that happen. Fred, I'm wearing my Double H vest today, and I did that because I was up at camp yesterday. Just a quick shout out to my friends and colleagues up there. For those who don't know, it's a camp up in Lake Luzerne. It's a year-round camp, specializes in providing camp activities for children with medically qualifying conditions. Yes. Ages 6 to 16 primarily. Volunteers, medical volunteers, nurses, physicians, respiratory therapists, pharmacists from Albany Med make up really the majority of the volunteer workforce up there medically. And they're going to open up the summer for in-person camp for children, which is wonderful. They didn't do it last year. So I was up there yesterday, and I was excited, and I just wanted to wear this in support of them. Fred, last thing is our campaign, Retain, Recruit, Retain.
Yes.
Still going, still very important. And we have a website, albanymedcareers.com. Anything you want to say about those efforts?
I'll quote someone. Unless you're an astronaut or a professional baseball player, we have a job for you.
We have a job
Go
for
to
you.
the site, look for positions, please apply. We're interested. We want to bring you into the Albany Med family.
Yeah, for sure. Absolutely. I couldn't say it better. So thank you for that. Okay. Should be a nice weekend.
It's supposed to be. Father's Day.
Father's Day. Happy
Yes.
Father's Day to you.
Happy Father's Day to you.
And to
everyone out there.
We know it'll be a beautiful weekend. We know that we're able to provide care here 24/7 because we have people working nights and weekends.
Yes.
So we thank you. And so we'll be back again next week.
Tuesday.
All right. We ask that you once again please take care of yourself, take care of each other, and we'll see you next Tuesday.